Expert Perspectives in MBC, the ORSERDU Patient. Fengting Yan, MD, FACP, Breast Medical Oncologist, Swedish Providence, Seattle, Washington. Indication: ORSERDU, elacestrant, is indicated for the treatment of postmenopausal women or adult men with estrogen receptor ER-positive human epidermal growth factor receptor 2 HER2-negative, ESR1 mutated advanced or metastatic breast cancer with disease progression following at least one line of endocrine therapy. Important safety information, warnings and precautions. Dyslipidemia, hypercholesterolemia and hypertriglyceridemia occurred in patients taking ORSERDU at an incidence of 30% and 27%, respectively. The incidence of grade 3 and 4 hypercholesterolemia and hypertriglyceridemia were 0.9% and 2.2%, respectively. Monitor lipid profile prior to starting and periodically while taking ORSERDU. Full important safety information will follow this video. How does ORSERDU address patient needs as a monotherapy?
Often the time in the second-line setting, we had to combine different agents to treat our patients. I'm comfortable using ORSERDU as monotherapy instead of other combination options in second line, given the efficacy ORSERDU provides by ES1 mutated, ER-positive, HER2-negative metastatic breast cancer patients. I need to assure you and my patients that ORSERDU was proved to be effective as a single agent. I'm very comfortable using ORSERDU as a single agent in the second-line setting.
Who is the ORSERDU patient?
I feel very comfortable choosing ORSERDU for patients with liver mets, lung mets, patients with HER2-low disease, or those patients who express both an ES1 and a PIK3CA AKT mutation. I also want to emphasize that for patients who has endocrine-sensitive disease, we should prioritize endocrine therapy, not IV chemotherapy, antibody-drug conjugate. In my opinion, when a disease is endocrine-sensitive, endocrine therapy should be prioritized and emphasized.
What about patients with both an ESR1 and a PIK3CA AKT mutation?
There are quite some patients with both ES1 and PIK3CA AKT mutation. The question, how do you choose between agents, comes up all the time. For my second-line patients with both an ESR1 and a PIK3CA AKT mutation who did well on endocrine therapy and CDK4/6 inhibitor in first line, I truly prioritize treating the ES1 mutation with ORSERDU for the efficacy, safety profile, and tolerability.
Do you consider re-challenging with endocrine therapy plus CDK4/6 inhibitor in the second line?
Should we re-challenge patients with a second CDK4/6 inhibitor in the second-line setting? In my opinion, if a patient already has ES1 mutation, we should target the ES1 mutation by ORSERDU rather than trying a different CDK4/6 inhibitor. I truly appreciate the option of ORSERDU I have in my pocket today. I do have quite some patients when it's in the stage 4 setting. I teach them that they need to have a bucket list. They need to have their life. With the option of ORSERDU in my pocket, even it's a stage 4 cancer, they can move on with their life. I truly appreciate the option I have today.
Indication: ORSERDU, elacestrant, is indicated for the treatment of postmenopausal women or adult men with estrogen receptor ER-positive, human epidermal growth factor receptor 2, HER2-negative, ESR1 mutated advanced or metastatic breast cancer with disease progression following at least one line of endocrine therapy. Important safety information, warnings and precautions. Dyslipidemia, hypercholesterolemia and hypertriglyceridemia occurred in patients taking ORSERDU at an incidence of 30% and 27%, respectively. The incidence of grade 3 and 4 hypercholesterolemia and hypertriglyceridemia were 0.9% and 2.2%, respectively. Monitor lipid profile prior to starting and periodically while taking ORSERDU. Embryo-fetal toxicity. Based on findings in animals and its mechanism of action, ORSERDU can cause fetal harm when administered to a pregnant woman. Advise pregnant women and females of reproductive potential of the potential risk to a fetus. Advise females of reproductive potential to use effective contraception during treatment with ORSERDU and for 1 week after the last dose. Advise male patients with female partners of reproductive potential to use effective contraception during treatment with ORSERDU and for 1 week after the last dose. Adverse reactions. Serious adverse reactions occurred in 12% of patients who received ORSERDU. Serious adverse reactions in greater than 1% of patients who received ORSERDU were musculoskeletal pain, 1.7%, and nausea, 1.3%. Fatal adverse reactions occurred in 1.7% of patients who received ORSERDU, including cardiac arrest, septic shock, diverticulitis, and unknown cause, 1 patient each. The most common adverse reactions, greater than or equal to 10%, including laboratory abnormalities of ORSERDU, were musculoskeletal pain, 41%, nausea, 35%, increased cholesterol, 30%, increased AST, 29%, increased triglycerides, 27%, fatigue, 26%, decreased hemoglobin, 26%, vomiting, 19%, increased ALT, 17%, decreased sodium, 16%, increased creatinine, 16%, decreased appetite, 15%, diarrhea, 13%, headache, 12%, constipation, 12%, abdominal pain, 11%, hot flush, 11%, and dyspepsia, 10%. Drug interactions. Concomitant use with CYP3A4 inducers and/or inhibitors. Avoid concomitant use of strong or moderate CYP3A4 inhibitors with ORSERDU. Avoid concomitant use of strong or moderate CYP3A4 inducers with ORSERDU. Use in specific populations. Lactation. Advise lactating women to not breastfeed during treatment with ORSERDU and for 1 week after the last dose. Hepatic impairment. Avoid use of ORSERDU in patients with severe hepatic impairment, child PUC. Reduce the dose of ORSERDU in patients with moderate hepatic impairment, child PUB. The safety and effectiveness of ORSERDU in pediatric patients have not been established. ORSERDU is available as 345 mg tablets and 86 mg tablets. To report suspected adverse reactions, contact Stemline Therapeutics Incorporated at 1-877-332-7961 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see full prescribing information, including patient information.